patrons and our chairperson for the 3-month training program, Professor Vedagiri Ganeshan sir, and another patron, Sri J.V. Lakshman sir, and chief guests and special invitees, and B.J. Reddy sir, President WCOP, Ashok sir, coordinator of course of the course, and all other participants and core committee members and everyone present here. So a hearty welcome to you all again. So this is our 10th session on in the 3-month training program on psychosomatic disorders, and today we are going to discuss on infertility. So this is the extension of the previous session. Actually, yesterday in the previous session we have taken up only the insomnia. So we are continuing with that same session on the topic infertility. So may I request B.J. Reddy sir to initiate the session.
Okay. Chairman of the 3-month certificate course on psychosomatic disorders, Professor Vedagiri Ganeshan sir. Actually, she has announced everything. This is a continuation of 9th program, and we are entering into the 10th program. And already in 9th program, we have completed insomnia. Now we are entering into the another topic due to paucity of time that day. We could not cover it. And today, we are going to cover it because that topic is quite interesting one, infertility. And you know, this is a majority of the people, this infertility in the sense and not becoming pregnancy. So that is the very apt meaning. And you know, it all depends on, there are so many causes are there due to hormonal imbalance. And like that, there are so many techniques have to be applied as per the suggestion given by psychologists, as per suggestions given by doctors, as per suggestions given by village experts, elderly people. They used to suggest so many techniques for the couple. So this is a very interesting one. Now, I don't want to waste time in between because the expert is sitting before us. So we are all very eager to know from Vedagiri Ganeshan sir. Now I request once again welcome all the beloved participants. Now I welcome, I request our Ramadevi to hand over the mic to our Ganeshan sir so that we can hear about infertility.
Okay, thank you, sir.
Right.
Okay, sir. I request Ganeshan sir to take over the session.
Good evening, Professor Govinda Reddy, the President of WCOP, and Dr. R.B. Rao, Professor Ashok, Srimati Ramadevi, and dear participants. Today we are going to interact on the topic of infertility. And Ramadevi has already posed a question. She thought it is only hormonal imbalance, etc. But we know all the problems in the body depends on the attitude of the person. That is why it comes into the area of psychology. What a person feels positively or negatively, hatred, anxiety, so many things, they are producing the appropriate hormones in the body. Okay. Then it goes to the appropriate body part and influences that. So when we talk about infertility, we have to start from pubescence in the case of women. And if a girl is having a negative attitude towards men and sex, she will not reach puberty. Okay, the system will not work. So it starts, fertility starts only with pubescence in case of women, and if they have a negative attitude, pubescence itself will be delayed. But in several cases, it will be preponed. For example, in the older days, it was 14 or 15 years. Now it starts occurring earlier and earlier. Even at the age of 9, it happens. Why? The attitude and the environment. The environment becomes a stimulant. At the same time, it can cause stress also. So the environment can create a positive or negative attitude to sex and marriage and childbirth. So these things influence the hormonal release and the blood chemistry, and the blood goes to appropriate organs and it restricts or inhibits normal functioning. So that is the way it works. That is the mechanism. It is the psychodynamic aspect. It is neurological, physiological, hormonal, everything depends on the environment and the reaction of the person to the environmental stimulation. Either the person gets attracted or becomes aversive. These are the ways in which it works. For example, I will take a case of lack of pubescence or late pubescence. A 17-year-old girl, okay, in her family, people reach the pubescence at the age of 13. But up to 17, she never got the pubescence. And she was married already 6 months back. And she's 17. And the mother of the girl goes to the gynecologist and asks why she has not reached pubescence. And the medical expert gives tonics. Okay, she thinks it will become okay, but no response. Then the case was brought to a psychologist. Now the psychologist starts probing the environmental situations of that family. The father, mother, and the son. Okay, and this, I am sorry, father, mother, and the daughter. And there is a boy who serves in the shop of the father. Okay. Now, when I inquire into the detail, I interview the mother and the daughter, but the father is dead and gone already. So when I interview the husband, who is a servant, who is looking after the business in the shop, when I interviewed him, he revealed that he has been used or sexually abused prior to marriage and even after marriage by the mother-in-law. Okay. Now, this girl who is married at the age of 16 until 17, she has not reached pubescence. Why she has not reached the natural process of pubescence is because after seeing the boy or her husband now, earlier he was only a servant. She has seen that he was having illicit relationship with the mother. It was shocking, and she started hating sex. Okay, so once she started hating, the inhibition has created particular hormones which block the onset of pubescence. And the mother says she should reach pubescence and she should beget a child because the other girls are getting children. So there is infertility, the case of infertility. But the origin itself is the problem. She has not reached even pubescence. Now, how to handle the case? Then I called the mother and said, you set aside the couple away from your home. Okay, don't keep the girl and her husband with your home. And now she has become a widow. Maybe the cause of death of the father is she has come to know that there is something going on in the illicit relationship of the wife with the servant who is in the shop. That would have led to a heart attack, or it would have been a suicide also with possible. I am not investigating into that. But now how to repair this case? And no amount of medical help will help. No amount of hormonal injection will help. So the attitude has to be changed. First step is the couple should move out of the house of that lady. Okay. Environmental manipulation first. And they have agreed to shift because that is what the husband also wanted. Okay. So that is protected. She did not see the mother because when she sees the mother, it is nauseating for her to recall that kind of traumatic incidents where she has witnessed the mother and the boy together. And the boy was forced to have sex with the mother-in-law. Now, she doesn't want to leave the boy. So what she did, she gave the daughter by marriage to the servant boy, and now he has become a son-in-law. But the girl hates to be in the presence of mother. Okay. So mother is a threat, and seeing mother creates inhibition. Okay, psychoneurohormonal inhibition. So first thing is to environmental manipulation, shift the family of the girl and the boy, the husband and wife, away from the mother, and they have agreed. All the parties have agreed. Second stage is this girl starts hating being a woman. She's a woman, but she hates being a woman because she thinks the body is dirty. A woman's body is dirty because of what she has witnessed with the mother and her presently husband. Earlier, he was a servant. Now, how to remove this kind of inhibition towards her own body? One of the technique which was used was some pictures from magazines were cut and arranged in an album. First, a fully dressed lady was exposed to this girl, and she was asked to look at the picture. But if she doesn't like the body exposure of the models, she can nod her head and say no. Okay. So then the picture was removed, and she was asked to slowly breathe in and out and relax. And she can say next. That means when she says next, she is inviting the next picture to be seen by her. Okay, this is known as stimulus control technique. And also the whole process is desensitization towards the female body. Next, the picture shows little bit of upper body exposure, but fully dressed. Then she's asked to look at it. And if she feels comfortable, then she will say, okay, then we'll go to the next. But if she say no, then the album will be closed. And she has to slowly breathe in and out, and also to take more and more water, because water, it gives oxygen to the blood. Then after that, she will say next. When she said next, she is inviting the stimulus, and gradually it is introduced to semi-nude and ultimately total nude pictures of girls were shown. And she could tolerate, accept the female nudity, and her own body she has accepted. While doing this, she was in burqa, which is fully covering the body and also the face also. She did not even look at the face of the therapist. She was only looking down at the pictures. And the pictures were arranged from fully dressed to partly exposed to maximum exposed, like that. Some 10 pictures were used. Okay, this was only a single session. And she started accepting her body and the femininity. Very next day, she reached puberty at the age of 17 plus. So when she accepts the body, it says, okay, that is one thing. Next thing is, she will feel secure to be in a house with her husband away from the mother's place. And the mother and the boy have agreed not to meet each other. What will happen now in the absence of the father who is dead? This widow, if she has an urge, she has to find some other partner, which is not advised. But theoretically speaking, she will seek some other partner. Okay. Then immediately the next day, she reached puberty. Okay. So we say in Tamil, there is one word. Okay. The fruit which has not been ripened Unripe Fruit was the title. And this was published in a Tamil newspaper. Okay. So in Tamil, we call it as Kaniya the Kanni. Okay. The fruit which has not ripened, unripe fruit. She became ripe just because of this kind of desensitization technique and environmental manipulation technique. And she felt secure to be with her husband. And only then she got the pubescence. So what we understand from this particular case is when there is a insecure, threatening environment in the family, the girl will not get pubescence and the girl will not conceive at all. Okay, even hormonal therapy is given, she will not conceive. If she finds the husband as a threat or the mother-in-law or sister-in-law or father-in-law as a threat, she will not conceive. Because that normal, natural reproductive behavior gets inhibited because of the environment. Okay, it happens in animals also. Animals, when they are in an insecure environment, they will not have fertility. Animal experiments have proved. So the same thing applies to humans also. So what we have to do is we have to equip the girl who is infertile to confront the situation, or we have to advise the people in the family not to threaten and to be loving and caring for this girl. Then only she will become fertile. Another possibility is when there is an insecure environment, the husband is hurting, threatening, beating, and the mother-in-law is also hurting, mother-in-law is hurting, and the husband is attached to the mother and the father, and the girl is left to lurch. The girl feels insecure and she finds how I can bear a child in this adverse environment if she thinks she will not conceive first. Second, if at all she conceives, she will abort. Repeated abortions occur, not because of physiological reason, but it is because of psychosomatic reason. So what is required is the environmental manipulation is very important. And also this lady's mind should be made to be receptive and positive. Only then fertility will occur. Okay. So this is a short briefing about this case and in general. Now, any observation is welcome.
Sir, in our
Yes.
campus only,
Yes.
in our campus only,
Okay.
they are from the same department. They are research scholars.
Okay.
Since then, they had this gentleman used to go to her house. Her house, and she is also alone. They took a house. Both are just like both husband and wife. They used to reside.
Okay.
And you know, but they are not going for marriage.
Okay.
But at the same time, they are continuing just a relationship. This
Okay.
gentleman, almost husband and wife, total. He used
Okay.
to stay back in the night also.
Okay.
So, but every time, the moment that girl gets pregnancy, they used to go for abortion. Like this, 5 to 6 abortions in a couple of years, they have just they have carried out. And subsequently, no children later on. They got married after a long time. After giving 15 years, then forcibly from that side and this side, unnecessarily you are entering into just your post 45 also.
Okay.
So then well-wishers just suggested them, okay, past is past. At least you go for marriage. And they went for marriage. No children. What might be the reason, sir?
Okay. Now, there is an aversion which develops or a negative feeling, and the brain gives a command, no children. You see, when they have abortion, they are giving a message to the brain, okay, you get inhibited, don't bear a child. The brain says, okay, we will not have a child. But marriage is only a social occasion. But you have already instructed the brain, don't go for a child. Because even if you create a child, we are going to abort. So brain is like a person who is highly sensitive, or it is highly like a pet animal. So if you give a command to a dog or an elephant, it strictly follows. But later you say change, then change becomes difficult. Brain will not understand because it records the older command and goes by the older command. Okay, but it can be changed. The older command can be rewritten by appropriate desensitization technique. Okay, the brain has to be informed in a reverse way, in a systematic way. Then they will get a child. The infertility will disappear. Okay. For example, it is very interesting, curious, and you can't believe it. If a man starts masturbating, that is one situation. The person has sex with the woman, second situation. And if we take the sperm count, the brain has reduced the number of sperms in the first masturbatory case. The same man has sex with a woman, then the sperm is released more and more. The number of sperm released is more. So the brain says masturbation is a useless attempt. So sperm need not be released. But to have sex with a woman, it requires the woman to get pregnant and the reproductive behavior has to start. So the brain is very smart in watching and giving commands to appropriate organs to release or not to release sperms. Same way, the woman's brain will also give a command to have a child and not to have a child. Okay? And the ovulation will not happen. Even if they have sex, the egg will not accept the sperm because the lady feels, I am living in an insecure environment. It happens during war, emergencies, poverty. Then people become infertile. They will have sex, but they will not have fertility because the situation, food is not there, war is there, there is a threat. How I am going to develop my child in this situation? So they become infertile. And another thing, experiments on rats, crowding, it's known as crowding experiments have shown when the crowd increases, there will not be fertility among rats. Similarly, if there are too many thick population in an area like a big city, okay, then the brain knows it's going to be difficult to get an offspring into bring up the offspring in this place which is highly crowded. So the crowding becomes a stressor and that affects the fertility or infertility, like that. So the brain is very sensitive and if it is trained to do something, it will do. But then unless we have to give a reverse command. Okay. That's my observation.
Right, sir. Thank you, sir. Yes,
Welcome.
Ramadevi.
Sir, a question. When we talk about infertility, we talk about more about women. But how about infertility that affects men? Because they say that there is no sperm count, or there is some spermatozoa gene, or no active sperms are present there. So how it is going to affect men, sir?
It affects both equally, both the genders it affects. The mind of a man, the thought and attitude and the anxiety, etc. They release appropriate hormones and the blood chemistry changes and that blood only goes to all the organs relating to reproductive organs. That affects. The man feels guilty. And also, if a man feels sex is very bad, the sperm will not be released, as I have told in the previous case. First of all, he will avoid the frequency of sex. And if at all there is sex, the sperm count will be less. Okay, because it is administered by the attitude of the man or the woman, like that. So what is required is you have to give cognitive behavior therapy in changing the attitude to sex, attitude to childbearing, attitude to infertility. Suppose a woman is afraid of delivery, okay, then she will not conceive at all. She will become infertile because she hears from other women that it's going to be a terrible experience. Then her brain understands, no sex, okay, no child, no delivery, no sex. Then she will not have ovulation at all. Whatever be the stimulation by the hormone, she will not have. A rape victim also develops a negative attitude to sex. She will not be fertile. So what is the solution for a rape victim? She thinks it is a generalized anxiety towards any man and towards marriage, towards sex also. How to solve it? What is the behavioral technique to solve it is because she thinks any man at any time may hurt me, like that, including the husband. She becomes aversive to the husband also. So this is what we can call as stimulus generalization. Somebody has hurt the woman. She thinks any man at any time will hurt, like that. So now she has to discriminate between the husband and the stranger. So if you give self-defense training, then her brain understands, okay, my husband is okay, but if it is anybody else, I will attack. She develops a kind of resistive, defensive attitude. Then things will be all right. So in our experience, we have used a lot of women who are having some difficulty in pregnancy and delivery. So we have given self-defense to them. And after that, they become all. Okay. Experiments we have done in Coimbatore itself through some of my doctoral students.
So
Yes,
for males, we have to give the CBT method of changing their attitude to it.
Yeah, males will not have erection. Okay, they will have erection, but will not ejaculate. In case even if they ejaculate, there will be sperm count will be less. Okay, because they read some wrong material and they feel having sex is dirty, and they avoid sex. And sparingly they have sex. Even then, the mind says this is a dirty job. Then things are blocked. So presently, we are handling a case now. The man says he wanted to become a sannyasi, okay, but he is married and having a 7-year-old daughter. And the wife says he is keeping away from sex, but his brain says be a sannyasi because the learning he had from his mother. So we have to erase that writing, okay? We have to do some software programming of the brain and make it accept sex as a normal general process. So what I have told him, you better become a sannyasi, I will recommend you to go to an ashram or you perform sex. Now he is considering to choose, okay? And he'll be all right. If he is gradually introduced to sexual stimulation, he'll be all right. If it is not done, you know what will happen? The wife will develop extramarital relationship. So wherever there is an extramarital relationship, that is because the husband is not giving pleasure. Okay. And she may conceive and have a child, and she will say, this child is not my husband's child, but it is somebody else's child. All these things happen in the society in a limited way. We can't generalize. These are rare cases. What we are talking about is a rare case. Okay. Our Lakshmana Rao Garu is thinking about asking something. Welcome.
Good evening, sir. I am very late because of some. I was asked to inaugurate in a hospital, so they took me there, and then so I was in hurry. But anyway, I inaugurated and came back.
Okay.
Because they wanted a senior man like me to inaugurate that.
Yeah, very good, very good.
Congratulations, sir.
Thank you. So, and they have taken out all my parameters, and they said, you, at this age, you can't have all these things like this. Everything is perfect. See, they gave me the certificate and said that these are all the tests they did. And then I became very happy about that because I never bothered about all these things. But when they proved that by record of after testing me, because they
clean sheet.
clean sheet and they give me a record of all the things that I dispute. So they said, no, you're
So your anxiety has gone.
only my blood pressure was 130/80.
Okay.
Normal.
130/80. So normally I used to have 120, 122/73 like that. So, but normally I don't go for all these tests. As long as I am healthy, I don't want to have any.
That's right. Yeah.
So that was the reason why I came late.
It's okay. Perfectly all right.
Okay. I wanted to be punctual about it, but I thought whether I should join in the middle or not.
Welcome.
Thank you, sir, for recognizing me that I'm already in. Already. See, I have one question, sir. Those who have pets in their home, normally though they will not have children. I have seen, of course, I myself was a pet lover. I have 5, 6 dogs in my house. So they said you have too many dogs. Of course, my wife was a medical case of she has a ovarian cyst and all that, but and she was not ovulating. So that's my personal issue. But uh, was it a cause for her ovarian difficulty because of the dogs that we were having in the house? Is there any link to that?
Actually, when people love dogs, okay, they are more attached to pets than humans. They are more attached to pets than humans.
Oh, I see.
The distancing from humans, because you can have more control on the dog than on humans. This is the one reason. Because they are under your command. If you lie, sit, stand, and throw, they will do it. Okay, humans will not do it. Even children will not do it. Life partners will not do it. So gradually, you get attached to it, but maybe that is one reason which I am questioning.
Because medical tests proved to me on both sides, of course, she was slow in ovulating, but I was quite a normal person. In fact, they said you have lots of them. So, but anyway, I thought I should adopt a child or something for my wife. I was not ready for that.
Now, what happens, in some couples, because it is an occupational hazard.
Sir, Lakshma sir, can you please mute your mic, sir?
Oh yes, I shall do so. Thank you.
Because it becomes an occupational hazard for a husband who is traveling too often. Okay, in some jobs, it happens like that, like a medical representative or a politician, like that. When they travel and come back, it will be a safe period. The fertile period or the heat period may occur during their travel. But when they arrive, the heat period is already gone. It is known as the estrus cycle in humans as well as animals. People may not notice that. So one way to diagnose the estrus cycle is to have a thermometer, okay, which is known as a basal thermometer. Early morning, when the wife gets up from the bed, immediately she has to put it in the armpit and find the temperature and record it in a sheet, graph sheet. On a particular day, it will shoot up, and that is the date of ovulation. That is the way of identification. If the person, they have sex on that day, they will definitely become pregnant. But the man may not be available on that day. He would have gone somewhere here and there, like that. Those who are traveling a lot, too busy with their profession, sometimes when the fertile period comes, they will be away. Okay? And it comes only 1 or 2 days. The body temperature is the indicator. Okay? So experts in gynecology, they advise to maintain the record of body temperature, basal body temperature of the woman, and at any cost, the man should be there to fertilize. Okay, but sometimes it may not happen.
But that is a valid. See, it was not like that. My wife was not showing the signs of ovulation because she had only one ovary. So that was not functioning, the doctor said. So I spent, but one thing they said, you can go for some sort of artificial insemination later in our 50 years. Till then there was no such facility as such. And they want me to be at least 1 year, we have to try, and then I asked my wife, at this age what we can do. See, the child will be very small when we are grown up. So that we have that sort of a thing, because the first test tube JV in Calcutta was the indicator that we should go for it. But we could not do that, and it's a practical thing that I have been trying. Otherwise, we spent a lot of money.
For example, I asked a couple, would you like to have a child on the 10th month? And the wife said, not now, maybe after 1 year. I asked why, because she said, we are waiting for a case on property to be won. After the case wins and the property comes, then we can plan for a child, parenthood. That itself will block. Okay, it is like a tablet, no tablet, but the brain gives a tablet or injection which says no. But they say we are infertile and we want to have a child. The attitude is no, not now. So I asked the question, would you like to have a child by the 10th month from now? She said, no, maybe after 1 year, after the case comes. And you know about Indian courts, when the case will come, when the judgment will come, okay, or in other words, she doesn't want to have a child, basically.
Yes, I very much agree for this, because the first few years of our marriage, she said, I am scared of delivery, I am scared of this, that, I don't want this child now, and all that. She used to give all sorts of
inhibition. Yeah. That's a particular hormone.
But she was very good at rearing the children of her sisters and brothers and all that. But she had that fear of delivery and all that.
Now, if we come to know that some lady is having fear of delivery, I would suggest one simple exercise. Okay, that exercise I think I would have told in some other family counseling also, which I will repeat now because it is relating to infertility and childbearing, delivery. It goes like this. Make a long sound, hissing sound. Then little shorter, shortest. So I am showing the hand only to show the length of the release of the sound. Okay, then they can do it without movement of the hand. If they do like that, what happens? The stress during this period shifts to the head, the mouth, and the ears. Okay, when they do like that, they have to do it 10 minutes per day. Okay, then from the pregnancy level or even before getting pregnant, they should do it on the delivery table also. When they do it on the delivery table, the whole stress goes to the head and the pelvic region becomes automatically relaxed, and the natural process, the child is pushed out. And we have done it in several cases in treating aversion to what we call as a pain-free delivery.
That is after conceiving, but she used to
No, no,
fear of.
if they do like this, or fear of anxiety, this delivery will go away. A person who has not conceived also, if she does like this, then fear of delivery will go away. Because the whole attention is on the head. Okay? The pelvic region becomes relaxed. Then she will be able to accept it.
Anyway,
And there are few other techniques also of desensitization. Okay.
because I was not guided and no doctor was trying to do all these things. Now the science has developed so much. So I will. I didn't have child finally.
Okay. Okay. Yes. Next. Getsi wants to say something.
Hello, sir. Good evening. Good evening, all.
Getsi, tell me.
So, sir, there are so many problems related to this infertility, right? Especially the couple issues that come and the family, extended family that is involved in this. But what goes on between the couple, nobody knows outside. And so here, as you know, there are so many issues, right? As far as the intimacy thing is concerned. I have two questions, sir. One is, there are so many things like the erectile issues, and they say that actually, particularly yesterday, there was a case was like, my wife is always staring at me, ma'am. Whenever I come out from the bathroom, she is like very sarcastic, and she's telling me that it is so small, your organ is so small, and she doesn't want to be with him at all. In fact, she is going with her boss in front of him. I mean, when he is aware of it. So how do we handle such cases which are like stemming from the physical thing parts?
Okay.
All the
Now,
early ejaculation issues and
That-
even those issues that are related to it. And one more thing that is related is like emotionally, they say that we are not connected, so we don't do it. So like all of this
Okay.
contributing.
Okay. Okay. Now, just you have to see what is their attitude to the husband. How much she is earning and how much the husband is earning. Suppose she earns more than the husband, she thinks that he is a lower category. That is one thing. So the attitude will be, she will not be attached.
Correct.
In this case, I am telling, she thinks a higher level officer, she thinks he is manly. And this man is income is less. Then she says, you are not manly. That is one thing. But nothing to do with the organ size. Because she would have seen a lot of phone videos where there are actors who are selected, like actresses, they are selected for certain physical characteristics. By seeing that, she thinks, she starts comparing with that actor's size or with the manager's size and this man's size. But size has nothing to do. As far as a person maintains erection for a fairly long time till the wife reaches orgasm, that is okay. It's a misnomer. The length and the thickness of the penis is a misnomer. Okay?
What is it, sir? What is the word?
Misnomer. Misnomer means it has no value.
Okay. Oh, fine. Nice.
So, but she thinks, then her attitude changes. Okay, and when she says that you have got a smaller thing, he becomes inferior and he will become impotent.
Exactly. He is becoming more and more impotent.
Yeah. Now his erection will not come because threat. So the brain of this person will not work. So that is why Masters and Johnson, they say, to enjoy sex, the most important thing is the sex organ, dash the brain.
Correct.
Sex organ, dash the brain. If the brain says okay, it is okay. If the brain says not okay, it is not okay. Erection will not come, ovulation will not come, okay, orgasm will not come. Everything is at the high command. The CPU is there sitting on the head, inside the head. That you have to change. Not by talking, but by certain exercises. Okay. And she will find, hey, this man is okay. The man is a man, whether it is a manager or husband, man is a man. But she has nicely taken over to the temptation of going to the manager because the manager has reinforced. Okay. So who needs to be corrected? This couple plus that manager and his wife also need to be corrected. So you are not having one case, you are having 4 individuals who need help.
Right.
Desensitization is a major technique which will create inhibition and also excitation also. Can be done by certain exercises.
And one more. Okay, sir.
Yeah,
Just a
okay.
minute. Sometimes I believe that I was told that fantasization also has a arousal.
Yes. No, but fantasizing takes the person away from reality. So the fun.
Sir, you are mute. You are on the mute, so not able to.
Okay, now are you able to hear me?
Yes, now I can hear.
The fantasy will influence the release of the number of sperms in the man's semen. Because it will release more because he likes the fantasy, likes porn videos. But when it comes to reality, the brain says, no, that model is more attractive than this person. Though it is real, then the sperm count is reduced. Because brain is a smart thing which regulates the flow of sperms. Okay. Or it can do the reverse also. In the previous thing I said, it's doing the reverse. If it is masturbation, it doesn't release. If it is actual sex, it releases. In this particular case, in fantasy, it will release, but not on a real person. Because the brain starts comparing visually, okay? And then that person is a model, this person is not a model. So the brain says, no, the sperm count is less. And the doctors see the sperm count and say there is some problem with this guy. It's not with the guy, it's his attitude to sex in general and to the partner in particular. Okay. That is why it is an interdisciplinary area. Okay. All the fields of psychology.
Most of it is controlled by the brain rather than physical.
Yeah, brain means the attitude.
That's why it has been included in psychology.
And medical experts know that. Okay. So it should become part of their curriculum. How to manipulate and change, like doing surgery. They should know how to change the attitude of the person. So it should be a teamwork of.
How does it happen? How does it happen during the rape cases? Some women also conceive. Is it something different from what all we are discussing? In rape, actually the women must be terribly feared, but they also conceive.
One thing, in case of rape, what happens? Somebody starts liking it, liking the experience. Okay, that's why I used to quote some films like presidential award-winning films. Okay, like there are Shyam Benegal's film, best directed film, Ankhor. Okay, and also the film, Hollywood film, Driver. Okay, the rapist is loved by the woman because she wants to be handled roughly.
Certain aggressiveness is liked by them, perhaps.
Yeah, that's the attitude of that lady. Because she has been handled softly by her partner. But when she comes across the kind of rough handling, She's excited. When she is excited, it leads to pregnancy. Okay. Now, 1 minute.
Yes.
Our Shanti Sri wants to ask.
Shanti Sri is waiting.
Namaste, sir.
please.
Namaste.
Namaste.
Sir, nowadays ADHD and autism has a high raise in newborns and young children. Is it
Yes.
due to this? Does this infertility treatment is affecting them? The children are born. That's one
It is-
doubt, sir. One query, sir. The other one is, I am a family counselor also. Lots of time I am facing couple doubting each other, and that is also seizing their this child conceiving and all. So
Who
these are
doubts?
two different aspects. Can you please throw some light on it, sir? Thank you very much.
Who doubts whom? The husband doubts or the wife doubts?
Most of the time it's the wife who is doubting the husband. Most of the time, checking the actually media also, like social media also is influencing their life. That is we all know. Checking this one, and most of the time it's the text message which is wrongly interpreted by the wife. Sometimes it sounds silly, but when they come, we open up and see the conversations. The perception of the wife, the way she interprets, is affecting their marital life to an extent where these kind of conflicts are coming to the, like they are going to the divorce also.
Okay. I can suggest a rule of the thumb method to people who are dealing with family counseling or sex therapy, okay, marital counseling, etc. Rule of the thumb is whoever suspects is having inadequacy.
Yes,
They are
correct,
not
sir.
able to enjoy sex, or they are aversive to sex.
Insecurity. Yes, sir.
It's not insecurity. A man who suspects his wife is unable to satisfy the wife. And a wife should suspect the husband. She doesn't like sex. Okay. Sex is a very painful experience for her. And as a result, she avoids. And she thinks the husband is sex hungry and he is looking at or running after other women outside or in office. So who is to be treated? Those who are suspecting are to be treated first. Unless there is a solid evidence.
Okay, sir.
So I usually ask whether you have a solid evidence, proof that the man is carrying on with another woman or woman is carrying on with other men. Give me the proof. They have to become practical.
Exactly.
Down to earth. Then they will say, then I will ask, what is your problem? You are having inhibition, whether it's man or a woman. They say yes. Then we will treat. Okay.
Exactly.
Yeah, that is the thing. And you said about children becoming ADHD and all that.
Autism,
Yes.
sir. Autism is also very high, sir. I don't know why.
Yeah. No, it's not very high. Schools are coming up, etc. Okay, they start diagnosing, admitting, treating, and all that. That's different. But what is the cause for ADHD and other things? First of all, if the man and woman are not emotionally adjusted, loving each other, there is no true love. The biochemistry gets affected. And the child becomes a product of lack of adjustment. And it is going to have conflict. That is what leads to everything. Either they become aggressive or hyperactive or dull head, whatever. So one of the things is the sex life should be pleasant, enjoyable. And when the person is expecting a baby, she should have a very good environment. This is already told in all cultures, including Indian culture. It should not undergo stress. But if you have got a horrible husband, a horrible mother-in-law, a horrible sister-in-law, then how do you expect the product to be all right? Okay, the product will be affected. So we have to protect. We have to take care. Yeah. How to protect? We have to take care.
Yes, sir.
Provide a healthy environment for the childbearing woman. We have to give counseling to the parents-in-law, sister-in-laws, etc. That's why I always say, you don't treat one person, treat a group of people around that person.
Exactly, sir. Exactly. There was a caption in our SPU University when we were doing the course. on one of the this one faculty room it is there. When the child is not behaving well, admit the child and treat the parents. No?
Yeah, that's right. Admit the parents also. I would say admit the parents along with the child and treat.
Yeah, so it's very true. Very true. Thank you very much, sir. Thank you.
Welcome.
One question, so that we'll conclude it. From
Yes.
audience, one question, please.
This is the last question. One more question and we close.
What about Suresh, Elugu Suresh from Anantapur?
Sir.
Yeah.
Sir, good evening, sir.
Yeah, please.
Good evening.
Yeah. Sir, recently I've got one couple, sir.
Okay.
They have got married 6 years before.
Okay.
And 3 years because of Corona and all that time.
Okay.
And they were not engaged. Even after the marriage, from the day one,
okay,
they couldn't get contacted physically.
Okay.
Especially in intercourse.
Okay.
So even after 6 years,
Okay.
they are not able to do that intercourse, and
Okay.
both are very sacred and holy people. They are not depending on others, and they don't have extra.
Okay.
Still,
Okay.
they both believe that both are sacred and they are good. They have very good understanding, but coming to the this part, they are not able to do that one till now.
Yeah. No, actually, they are two serious people. Okay. And they think they want to directly go to heaven by abstaining from sex. You have to tell them, you have to qualify to go to the heaven. That is why you go to Konarak and Khajuraho, and even in Tirupati, go to Govindaraja Swami temple in the ground level. And while you enter, have a look at the right and left of the entry point. There are so many erotic sculptures there, as much as what is there found in Konarak or Khajuraho. It is there in almost all the temples in Madurai, in so many places. Okay. So ask them why Govindaraja Swami temple is showing all these things at the entrance of Gopuram. You have to pass this and go there. Otherwise, you can't go to Vaikuntham or Kailasam. Okay, you have come here to do the job of childbearing, and then you go. Okay. Without that, if you go, they will shut the door and send you out from Vaikuntham and Kailasam. If that is the case, you should not have been married. Once you are married, do the job perfectly. Otherwise, okay. So you tell them and take them to. Are you from Tirupati?
Okay.
Okay, then take them to Govindaraja Swami temple, and you will find a lot of sculptures in the entry point in the wall, right and left. So many posters, erotic posters are there. So the elderly culture told, you have been born, you enjoy, have children, then you come to sannyas. After marrying, don't go for sannyas. Okay. You have to do a PG degree, only then PhD. You straight want to go for PhD degree with a UG. Okay, they will not permit you. You have to have PG degree with a 50% mark. Otherwise, you cannot register for PhD. Okay, you tell these guys. And then they will have starting trouble. How to release the starting trouble, there are techniques.
Okay.
We will discuss it later.
Right, sir. Thank you, sir.
Welcome.
Yes,
sir, excuse me, sir. I have prepared for a last question, but meanwhile, sir asked it.
Yes, it's all right. Please.
Sir, the other side of the matter, sir. If infertility is this much prevailing, why Indian population is so much increasing, sir? I mean, in rural areas and in poor people, it is very much common to have more than 2 children also, against the norms.
Yeah. Because they want workforce. Poor people want workforce.
Sir, but for them, all this.
At least to go and work in the field or to go and beg, they want more. hands to go and beg. So they produce. So when there is a desire, then God also blesses. And they have more children. But the educated people, they say, no, no, we don't want children. Then God says, okay, you will not have children. Okay.
Okay, sir. Okay.
That is it. So don't bother about
Fine.
the poor people getting more children. Later, with the government support, they may study and become IAS officers. We need not say only educated people should produce children. Okay, what is required is the brain. The brain can be shaped. With education or without education also, brain can be shaped. There are several people who are illiterates. They have become big bosses in business and philanthropists. Okay. So if educated people are not having children because they have got a wrong attitude, okay, at least they should have one child. That is what Hindu religious dharma says. Get married and have at least one child. And in Nambudris, in Malayalam, they say have only one child, not the second child. No, if you have a second child, you have to throw it out on the street. Only one child is with you. Second child, you leave it on your, okay, outside the house. Somebody will adopt it. That is also one type of family planning. Okay, not sannyas, not social, total sannyas. Okay. If
Yes,
there
sir.
are no further questions, then we will close it with the permission from the president.
Sir, I wanted to ask one question, sir.
But
In
you
the
are
first
coming too
case,
late. Varuna, why are you coming so late and asking the final question? And you have been watching all these things. Okay. Anyway,
no,
tell me.
sir, I wanted to ask, but then one of the others started asking. I didn't want to interrupt. It is a very tiny question, sir. In the first case that you discussed, you said you sensitized a girl to attain her puberty.
Okay.
So if we're having teenage daughters and they watch something which is sensitizing, that will that advance puberty also for them? I mean, nowadays the internet is there and everywhere, even in Hindi films, Telugu films, everywhere it's like semi-clad clothes, sir, and heroines and all this pelvic thrust and all.
That is why the environment only directly influences the brain, which influences the hormones, and then either it is preponed or postponed like that. A person likes the environment, they will arrive puberty earlier.
Okay,
if they say this is nonsense, they will not
everybody is saying it is due to the food and the genetically modified food that our daughters and the milk and all that physical reasons. But today, after hearing to you, I feel it's not only the physical food and all.
Attitude to sex. That is very important. Okay. So the parents have to be very careful in dealing with children.
What they watch and we have to be watchful. Thank you, sir. That's it. Thank you.
Welcome.
Shall we conclude, sir?
Yeah, please do.
Actually, just as a conclusionally, one statement I would like to pass on. Actually, in rural areas, grandfather and grandmothers are the real psychologists those days. So they know what to do and what not to do. They are the best guide for the children. Particularly, there are about 3 to 4 sons are there. And after right time, they used to go for perform the marriages, and right time, and at every stage, they used to guide. But now, as she said, now we are totally depending on YouTube and all technology. That is an unfortunate situation, but we are just all the old people are in the old age homes.
True, I agree with you. Yes.
That is my because olden days are golden days, I can say. Why? Because now technology is there and they are totally depending on this YouTube and for everything. YouTube is the just best. They think that the best solution for people, young people particularly. And those days in rural areas. They are the real psychologists, old people. Grandfather, grandmother are the real people. They used to guide the children properly, and those days the home was so good. environment was so good, everything was so good. But today, having developed and we are following these technical aspects, now we are suffering. That's what my conclusion.
Yeah, sure.
Thank you, sir. Ramadevi,
Sir,
please.
so the topic for today was infertility. So the environment has a very positive or a negative impact. If the girl or the woman has a positive attitude towards infertility, there are maximum number of chances to have the pregnancy or get her pubescent as well. So if it has both psychological, neurological, and physiological impact on the woman if the attitude has been negative towards the fertility, becoming mother. So in a case discussed by sir, the 17-year-old girl who was already married to the servant earlier and the servant at the home, and later he became the husband of her. So the father has expired and the mother has an illicit relationship with the boy, so which the girl was very much traumatized because of the relationship. So she was not able to have that attain the puberty even she was 17-year-old. So the first thing is we have to make an environmental manipulation. So the mother and the couple have to be made separately. So in spite of medications or anything, that doesn't help. So these desensitization technique and stimulus control technique has to be applied. So the girl has to be exposed with the pictures from the fully dressed to gradually increasing the level of nudity to the full nudity, so that the girl gets desensitized and get access to the body of herself, along with slowly breathing in and breathing out, so that the brain learns to accept her own body, and also the husband is with her, so she feels secure, and the mother is away, which is the reason for the trauma. So the next day, the girl has attained her puberty. So the environmental impact or the relation or the trauma also has a greater impact on the attaining the puberty. So just like the Karna ma'am has said that exposure to the stimulants also may be reason for early puberty. So the environment should be secure and it should not be threatening at home. Then the woman can attain the puberty or the pregnancy. So inhibition is the main cause, which is triggered in the brain. So if the person whoever may be living in either in the living relationship or the marriage, if they are prepared to have children without any inhibition in the mind, then they can have the pregnancy and even if they have, so if they have any miscarriages and the brain get tuned that have fun but don't get pregnant. So that's how some people will not get attain have the pregnancy. So in that cases we have to desensitize by reversing the process. So in masturbation, when men do the masturbation, they produce or release less sperm, and when they are in the intercourse, they release more sperm. So the women are impacted in the vast poverty, also have the very greater impact on the brain, and may not have the interest in becoming pregnant. So brain is a sensitive thing in which there is infertility. Infertility also impacts the male equally as female. So the CBT technique has to be applied to change the attitude towards the intercourse. Or so there are the causes for the women for not having the fertility, or is they might be afraid of delivery, or they might be afraid of having not to have sex or not to have any child. Similarly, a rape victim also gets generalized anxiety that okay, all men are brutal or all men are not good. So the men can hurt. So the woman has to discriminate between the husband and the stranger person, has to learn defensive techniques. then the brain learns that the husband is a secure person, and when the stranger touches, we need to defend. So in a case the brain wants to become a sannyasi, so we have to give an option that either go for leave the family and go to the sannyas ashram, or perform the marital affairs like gruhasthashram. So if the person, even after having many years of marital life, in some cases men lose the interest in the sex, and in such cases women may have, not in all cases, may have some extramarital relationship with the strangers. So in case of pets, too many pets at home, they might be getting more attached to the pets than humans, and that may have impact on having the infertility. So it's extra cycle or so when the women want to have plan for the pregnancy, there is a method that ovulation. Today we get ovulation kit. So that is woman has to check her basal temperature every morning and record it. So when the temperature raises a little high, it is the time for ovulation. Then the doctor is advised to have the intimacy. So if anything that triggers or anything that inhibits the brain of the men or the woman, that we should have the children after certain period of time, or after certain after like winning in a case, then the brain it is that you have to wait until the win, so the body doesn't react or the respond. So if the people, if any woman has a fear of delivery, there is a technique called breathing or making a sound like long sound, the little lengther, shorter and shortest. So this really works in when they have the fear of delivery, because the stress reaches to the brain and ears and the mouth and relaxes the pelvic region. So it can be done during the pregnancy, or the person who is ready to have want to conceive. So there are erectile issues as well. The woman sometimes compares the size, or the men also compares the size of his own organ and becomes inferior, and that also impacts their sexual life and their infertility. So fantasizing always takes away from the reality, so it influences the number of release of the sperm. So ADHD and infertility, it is because of some not having emotional adjustment between the couple. The child may have the adjustment issues. So the sex life should be enjoyable and the couple should not undergo any stress. So if the wife suspects husband or the husband suspects wife, so then it should be understood that the suspectant has some deficiency in them. So that has to be treated. So it is always good to have provide a healthy environment to the woman who wants to conceive. Even though the people who are married for many years, still they don't have the intercourse. So for them, we have to stimulate by showing the pictures of the temples or the sculptures on the Khajuraho temples or Govindaraja temples. So it is a basic responsibility of the couple to perform the duties of the marriage. So that is for today, and I hope I have covered all. So the brain has to be shaped.
Oh, covered all.
Good job.
Congratulate you.
Thank
Congratulate
you,
you.
sir.
A to G. You covered A to Z.
Thank you, sir.
Okay.
My
Thank
listening
you.
skills are improving. Thank you, sir. Thank you very much. Thank you, Ganeshan sir, for his valuable time. He has been sparing with us. And thank you, BJ Reddy sir and Lakshman sir also for making this program successful by giving your inputs to the participants. Thank you so much, all the participants, for being listening patiently. Most probably, I will put the session 9 and 10 by tomorrow. Thank you all, one and all, and have a pleasant evening.
Yeah.
Thank you.
Good night, everyone. Good night,
Thank
everyone.
you.
Good night, sir.
Good night. Good night. Thank you.
To our